Hi, this is Dr. Amie Harwick, licensed marriage and family therapist, and today we're going to talk about the morning sad, that depression that you feel in the morning, why it's happening, and what to do about it. There's a normal amount of kind of sluggishness in the morning, but if it's disruptive to your life or outside of your norm, it's time to take a look at it. So morning depression or morning sadness is actually a symptom of a depressive disorder. So depressive disorders are classified in the DSM, or the Diagnostic and Statistical Manual, and this is one of the symptoms. We use this classification as a way to look at a series of symptoms that occur together and then think of treatment options that work. So classification can be very helpful. So morning sadness can indicate many things, and the way you identify if you're having morning sadness is if you're feeling guilt and shame from laying around in the morning, you feel like you can't get up, having a sense of dread, maybe you even feel like you're lazy but you just can't get past it. That's when there's some type of problem, and when you realize there's a problem, it's time to make a change. So how do you know if your morning sadness or morning depression has crossed over into something that's more unhealthy than normal? Well, is it outside your norm? Does it deviate from your normal behavior? Some of these signs or symptoms could include things like laying around longer in bed than you're comfortable with, feeling guilt or shame about being in bed in the morning, feeling guilt or shame about your feelings, feeling more sadness than usual, intense emotions. Maybe you're looking at your phone for long periods of time, and before you know it, an hour has gone by and you don't feel any better. All of these are a sign of a bigger problem. Morning sadness, or greater feelings of sadness in the morning than other parts of the day, are actually symptoms of a depressive disorder. So before we jump right into treating a depressive disorder, let's take a look at the other contributing factors that might cause you to feel that sadness in the morning. So let's do a self-assessment. How are you eating? Are you eating healthy, frequently, balanced, inside or outside your normal behavior? How's your sleep? Are you getting 7 to 9 hours of sleep a night, or are you lacking sleep? What about activity? Are you laying around all day, or are you exercising and being active? Take a look at those things and see if anything pops up or stands out at you. What about even just physical issues? Have you seen a doctor lately? Have you gotten a physical? Have you had an injury? And lastly, take a look at substance and alcohol. Have you been taking more drugs lately or engaging in any type of drug-related behavior? Maybe you're drinking a little bit more than usual. Take a look at these things because these will affect depression. Make a change with those things first, and then take the next step and take a bigger look at depression. One of the causes for this morning depression is the circadian rhythm. So the circadian rhythm is a 24-hour time clock that helps regulate our moods and keeps us stable, both mentally and physically. When you go to bed at night or when the sun goes down, your body produces melatonin that makes you sleepy. In the morning, sun comes up, your body produces cortisol that wakes you up. Now, if you don't have regular sleeping habits or you have some type of depression, that can become dysregulated, which will affect your morning sadness. How do we fix that? What can you do about it? Maintaining a consistent schedule, a consistent sleep cycle, eating consistently, and having regular exercise can help maintain your circadian rhythm, which will then help alleviate your depression. But unfortunately, the circadian rhythm affects depression, and depression affects your circadian rhythm. So by working on keeping a consistent schedule, but also managing your depression, both those things together will help you succeed more. So what do you do about it? Well, there's a lot that you can do. You have so much control over what you're feeling and what you're experiencing right now. The first thing is go to therapy. Seeking a therapist will actually help so much. You'll help gain insight, awareness, and learn some coping tools to cope with your depression. You can also consult with a psychiatrist. SNRIs, or serotonin norepinephrine reuptake inhibitors, are a classification of antidepressants that are said to be very helpful. It doesn't hurt to talk to somebody about it. What else do you have control over? Well, don't search on social media or play on Instagram all morning because that's not going to help you. Let's get out of bed and create an environment in your bedroom that promotes sleepfulness at night and wakefulness in the morning. Try to avoid long naps. Exercise frequently. Eat healthy. Engage in positive self-care. Be positive and have positive self-talk with yourself. Some people say light boxes are also very helpful if part of this depression is related to seasonal affective disorder. I actually have one client that swears by taking cold showers in the morning as a part of his wakefulness routine. So there's a lot that you can do, including avoiding alcohol and drugs and other types of negative environments that help promote sleepfulness or depression. Remember, you have a lot of control over your mood. You control your mood, your thoughts, and your feelings. So engage in that and be proactive. Thanks for watching my video on morning sadness or morning depression. Hopefully it was helpful for you, or maybe information you can apply to a friend or family member. If you have any questions or comments, feel free to comment below. You can check me out on social media at Dr.Amie Harwig on Instagram or Facebook, or my website, dramieharwig.com. Until next time, thanks for watching.